All right, so our exercise program will be on a cancer patient. Our client is a 54-year-old Caucasian woman who has been battling melanoma cancer for a couple years now. She has had this in family history. She is 5'6" and weighs about 145 pounds. She has detected it before serious spreading has occurred. However, she has gone through a couple sessions of chemotherapy. So, for exercise testing on this client, since the chemotherapy has affected her cardiopulmonary functioning, muscular strength and endurance, and flexibility, there are a few tests that you should 100% have um, been applied to this client. Before any type of exercise testing has occurred, you need to make sure that the doctor has allowed her to do exercise, and you want to make sure that you go through her medical history background and if she has any other like effects that could potentially put her in more harm. So the 6-minute walk test is to test her gait and balance. So, since she has a lot of fatigue and chemotherapy is very hard on the body, this is a very good low impact test that you would want to run through with her. Another test for flexibility would be the modified sit and reach test. So, this is also very low impact, which you want to have, and you want to make sure that you're near her the entire time while she is doing this. But this will just be a good gauge to see where her flexibility is after her chemotherapy. So, to test muscular strength and endurance, you want to make sure that you're using very low weighted dumbbells, but just run her through some tests that will see how much, how fatigued her muscles can get or would get in exercise. The spirometer test is to test her pulmonary functioning. So, this will be a tube that you're going to have in her mouth, and it's going to test how much she can inhale for a full inhale and then how long it'll take for a full exhale. So, this can show any abnormal ventilation patterns that she might be going through or might have that you want to detect before putting her into an actual exercise program. And then the last one, which is very important for testing VO2 max, would be the modified Bruce treadmill test. And if possible, you want to hook her up to a 12 EKG just to test her cardiovascular functioning and capabilities. So, all of these tests will help see and gauge where your client is before wanting to put her into actual programs and just seeing where we need to start, because every client and every cancer patient will have different starting points, even though the recommendations will always lead up to 150 minutes.
All right. So it starts off. So as far as lifestyle choices go, leading to melanoma, we know that tanning indoors and outdoors, and just working outside, as far as being in the sunlight for so long, we know that can be dangerous. We know that sunlight and tanning beds are the main sources of UV rays. Sunlight a little bit less. It has very small portions of UV rays in it, but it does still have enough to damage your skin. So we do have to be careful when you're going outside, making sure you have proper coverage, either through sunscreen or some sort of like hat or shade screen or anything of that matter. And we know that skin cancer can begin to damage the effects of DNA genes, as far as that control your skin growth. So being careful for that. And we also know that research has shown melanoma might be caused by getting sunlight in places that you don't normally get sunlight in. So that includes your chest or your back and your legs. So just being aware of this and making our client aware of these actions, to know what to do better properly. And in her case, we might have her avoid peak sunlight hours, just be out, or just make sure she has really, really good proper coverage. And so as far as holistic treatments go, or overall, like instead of medication, just full body treatments or healthier body treatments go, I found that exercise and nutrition are the two main sources um, for helping battle this cancer. And so, as far as nutrition goes, we know that vital nutrients can help maintain a healthier body and fight infection. One of the main nutrients is antioxidants, either through food or through a supplement treatment, have been shown to help fight cancer by neutralizing free radicals or highly reactive chemicals that harm cells. And according to Healthline, the top five foods that are very high in antioxidants include dark chocolate, pecans, blueberries, strawberries, and artichokes. And we also know that fat and proteins have also been shown to fight cancer. So incorporating this in her diet more often will help her with during these very tough times. Um, as I also mentioned, exercise. Exercise can help keep your body strong and reduce fatigue you may experience from standard treatment. So that includes chemotherapy. We know that some of the side effects can be fatigue and nausea. Uh, Exercise can help ease some of these side effects, and it can also help boost your immune system and just keep you overall healthier during this time that your body is going through these major changes and is really getting hit hard with this. But just also making sure that you're cleared by your doctor to do exercise. Your body may not be in the proper condition to be able to do that. Making sure you're okay and just know your body, know what doesn't feel right and what does feel right, and make sure you're in constant contact with your medical supervisor or doctor um, throughout that whole process. And just know that
Some of the effects of exercise on a client with cancer is an improved quality of their physical life. Uh, Many patients with cancer, as they go through more and more chemotherapy, their body starts to break down, and normal daily activities become more and more difficult. Just simply walking around the house. In later stages, going to the bathroom can even be difficult, cooking, cleaning, doing work, things like that. So patients who regularly exercise see an improvement in their ability to do those kinds of things. Another effect of exercise is reduced pain during chemotherapy treatments. One of the main complaints of patients who go through chemotherapy is that they feel fatigued. They feel like they've been in a fight, or that they just had to run a marathon nonstop, and they just feel dead. They can't move, they can't walk, they don't want to talk, they just want to go home and go to sleep. And a study showed that 40 to 50% of that fatigue goes away with regular exercise. Patients who frequently exercise reported to have way less fatigue, way less tiredness after, during, and days after chemotherapy sessions. Not in all of these studies, they studied different types of exercise modalities, from resistance training to aerobic training, and different modalities within all of those, from resistance bands to body weight to free weights, running, walking at different intensities. And they were all proven to be beneficial. So any exercise of any kind, whatever the client prefers and is able to do at the time, will be beneficial. There hasn't been any studies showing necessarily what exercise would be the most beneficial, just that any exercise is beneficial. Along the same line of reduced fatigue is reduced discomfort during daily endeavors. Patients not only show less fatigue during and immediately after their chemotherapy sessions, but even in the days following chemotherapy sessions, they're more able to do day-to-day activities if they exercise regularly. The next effect of exercise is the improvement of remission and the speedy recovery that clients who regularly exercise see. So clients who exercise regularly usually go through remission much quicker because their bodies are healthier and more ready to accept medicine and chemotherapy, things like that. And then the last effect of exercise is patients will be generally more happy because of the mood boost that exercise shows. And with a disease like cancer, attitude is everything. If you have a bad attitude or feel defeated, it's very difficult for a patient to get over cancer. But the happier a person is, the more likely they are to recover.
Hello, my name is Maria, and for our cancer patients, micronutrients become super important because of the inflammatory process and the side effects of chemo and radiotherapy. So carbs are important. We can have some low-fat, non-fat dairy products or even some plant-based products, but we want to limit crackers, bread, cakes, and any other sweets. Protein, we want to have animal protein, nuts, seeds, anything like that. Some even soy products. We want to avoid processed meat, limit the red meat consumption to about 18 ounces per week. Pancreatine is primarily used in the fight against cancer cells, but it is also used in digestion. So a diet that has a lot of protein will use those cells in digestion rather than fighting against cancer. So we want to kind of limit their protein intake as well to about the recommended amount. Fat, we can have avocados, seeds, nut, fish, but we want to avoid fried food and the fat on the meat. Avocado is full of nutrients that is thought to help reduce the risk of skin cancer. And the fat on the meat actually can enhance the growth of cancer cells, which will then spread it. So we don't want that. For vitamins, vitamin D is very effective. It helps with, a deficiency can increase the risk of cancer. So there's thought, especially like breast cancer, and some food for that is salmon. Salmon is really, really great. Vitamin C and vitamin E can help with the reduction of pain and fatigue. Some examples of these food items are lemon, mango, avocado, and spinach. A meal example, so dinner is something super easy, grass-fed burger. So that's either the chicken or beef or any type of patty that they choose is grass-fed, or a veggie patty with some sweet potato salad and roasted Brussels sprouts. The combination of these foods will enhance the protective effects.
All right, so one of the things this cancer patient will want to do is perform a moderate intensity aerobic exercise at least 30 minutes, 3 times a week. Another thing they'll want to do is also participate in resistance exercise for at least 2 times a week. And they'll want to use a weight or resistance that uses at least 60% of that burden of that person's 1 rep max. Resistant bands, you can also use that as well. So here we just got 2 examples of what you can add for in a person's exercise prescription for someone who has cancer. For the one workout they can do is just a simple bike ride for 20 minutes, and then they can just walk for the next 15 minutes. So this is an aerobic type of workout that's going on here. Is both bike riding and walking are both aerobic type exercising. Works on the heart. And then the second workout here is a resistance bands workout, and it's got 4 different exercises here, as you can see here. These are all leg exercises right here. We got resistant bands, lateral walks, resistant bands, glute bridges. We got resistant bands, adductors, and resistant bands, glute kickbacks. These are all leg exercises, like I said. And then they can just finish it off with jogging for about 15 minutes. And then lastly, doing these exercises, it reduces anxiety, depression, and fatigue among, clients with cancer, and also improves the quality of life and their physical function as well. All right, so just a quick summary of, the program that we got here. The client, she'll want to participate in holistic treatment programs. She'll also want to make sure to really keep track of her nutrition, avoiding processed meats, limiting carbs and fried foods, as well as eating plenty of vitamin C, D, and E, just, keep yourself healthy nutrition-wise so that other risk factors for cancer doesn't build up. And she'll also participate in at least 30 minutes of physical activity 3 times a week, with her workouts consisting of both resistance training and aerobic training. And then, just the ultimate goal is to keep up as much physical activity as possible and keep track of nutrition, just so they can stay healthy.